Hello guys, welcome to Medico. Today I want to explain everything you need to know about vertebral column. Totally we have 33 vertebra, which divide to 7 cervical, 12 thoracic, and 5 lumbar. Also we have 5 sacrum and 3 to 4 coccyx. Each vertebra has two parts. The first one is vertebral body. It varies the weight of our body, and between these vertebral bodies we have cartilage called intervertebral disc. Uh, at the posterior side we have vertebral arch, which contains pedicle that attach the arch to the body, and laminas. Also we have a spinous process that project posteriorly inferiorly from laminas, and it's for muscle and ligament attachment. On lateral side, we have two transfer process, uh, which posterolaterally project from the arch, and they have articulation with ribs only in thoracic vertebra. On other side, we have superior articular process and inferior articular process, which are responsible for attachment with other vertebrae. So here we can see the thoracic vertebra. This is the superior articular process, and this is inferior articular process of upper vertebra. They attach in this order together. So from the beginning, we have cervical vertebra. These are between the thorax and the skull. They are small, and they have presence of foramen in each transfer process called foramen transversarium, and it is passage for nerves and veins. Also, like other vertebrae, they have a spinous process and vertebral body, and also they have vertebral canal for passage of spinal cord. So the first and second cervical vertebra, we call them atlas and axis. The first one, we have posterior tubercle and anterior tubercle, and there is facet for articulation with occipital condyle of skull, because it's the first cervical vertebra attached to the skull. And there is one facet here for dens. The dens allows the atlas and head to rotate on an axis side to side. Also, dens of axis attached to the atlas, and it's held in position by transverse ligament of atlas, as you can see here. These two vertebrae are specialized for accommodate movement of head, and they lack of vertebral body, and they don't have any intervertebral disc. So this is the second vertebra, cervical vertebra, called axis. It has dens and articulation site for attachment with atlas. Also, another important ligament is alar ligament. It attached to the two superlateral surface of the dens and connected dens to the medial surface of occipital condyle. The next vertebra is thoracic vertebra. It's the same like other vertebra, and it has transfer process, spinous process, but the difference is it has two facet for articulation with ribs, and also another facet here for articulation with tubercle of its own ribs. So as you can see here, we have the thoracic vertebra and it's the ribs attached to the vertebral body here, two ribs attached to one vertebral body, but only one ribs attached to the transfer process. So the next one is lumbar. They are responsible for skeletal support for posterior abdominal wall. They characterized by their large size. They have large vertebral body because they carry most of the weight of our body, and they lack facets for articulation with ribs. And like other vertebrae, they have transfer process and spinous process. The next one is sacrum. It attached superiorly to the L5 and inferiorly to the coccyx. It has L-shaped facet for articulation with pelvic bones. It has four pairs of sacral foramina in posterior and anterior side for passage of nerves. And the last one is coccyx. It's a small triangular bone articulate with inferior point of sacrum and has 3 to 4 fused coccygeal vertebra, and there are absence of arch and canal in this vertebra. And the last thing that I want to explain to you is about intervertebral foramina. It formed each side between the vertebra. It allows passage for spinal nerve and blood vessels formed by inferior vertebral notch and in superior vertebral notch. So that's all for first part. You can also watch the second part, and please like and subscribe. See you next time.